Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. I want to update you today on the adaptogen herbs that have been shown to mitigate the negative effects of stress on the body and the brain. Now, my favorite adaptogen herbs are Ashwagandha, Rhodiola, and Schisandra. Possibly you've never heard of them before, but I'm going to explain to you where they might be important in your life. So, when we're faced with chronic stress, which is a common feature in modern society, our adrenal glands are prompted to pump out more cortisol, which is the stress hormone, than is often desirable for optimal health. So, chronically high levels of cortisol can produce many negative effects on the body and the brain, such as increasing inflammation and worsening inflammatory diseases like arthritis and some autoimmune conditions. High levels of cortisol due to stress can also decrease your immune system function, which increases your risk of infection and even cancer. High levels of cortisol can also raise your blood sugar levels, which can trigger the onset of type 2 diabetes or exacerbate existing diabetic conditions. High cortisol can also damage brain cells in a way that negatively impacts our memory, learning ability, and even our sleep cycles. And it can change brain chemistry in ways that trigger or worsen mental health problems, as you're going to see, such as depression, burnout syndrome, and anxiety. Now, in 2017, the Georgia State Honors College Undergraduate Research Journal published a review of recent human studies where adaptogen herbs like Ashwagandha, Schisandra, and Rhodiola were used in the treatment of patients who were diagnosed with stress burnout, anxiety, stress-induced fatigue, mental fatigue from shift work and exhausting work schedules, and patients that gained weight where stress was a factor in their weight gain. Each of the studies showed that supplementation with adaptogen herbs was effective at not only improving these symptoms along with the patient's vitality and resilience, but supplementation with these herbs also lowered blood cortisol levels in the patients in these studies. So other studies published in the Journal of Neuropsychiatry Disease Treatments in 2017 and in the Indian Journal of Psychological Medicine in 2012 have shown similar results with patients suffering from similar conditions. Human clinical trials have shown that when used in conjunction with antidepressant or anti-anxiety drugs, patients using adaptogen herbs often respond better to the treatment than do the patients who are not using adaptogen herbs. An excellent review in the journal Pharmaceuticals in 2010 highlighted the study showing that adaptogen herb supplementation has also reduced major side effects of drugs that are used to treat schizophrenia and depression. And also these herbs have been shown to improve the recovery of patients recovering from influenza and pneumonia. And also the herbs have enhanced recovery from depression and improved physical performance in those who work or train very hard physically. Unfortunately, as helpful as they can be, some adaptogen herbs can also be dangerous to use, in my view, in the view of many experts, such as ginseng and licorice root extract. These two adaptogen herbs can interact badly with many types of medications, causing untoward and even life-threatening side effects. They can also produce adverse effects on blood pressure and on the heart, produce skin rashes, and impair the normal detoxification of coffee, alcohol, and acetaminophen found in drugs like Tylenol. On the other hand, the use of Ashwagandha, Schisandra, and Rhodiola have shown a high level of safety and efficacy in human studies, which means that most people can use these herbs without risk of any major side effects. So based on the available human studies and experimental and experiential evidence, here are some examples where a supplement combination of safe adaptogen herbs can be considered as an ancillary measure to help combat the effects of stress, enhance recovery, and improve certain health outcomes. So people who have sort of general unexplained fatigue, they've been to the doctor, they can't find anything wrong, the person just can't find the energy they used to have. Often that's a sign of sort of stress impacting the body where adaptogen herbs can be helpful. The same in athletes who are overtraining and they hit the wall and they can't get further gains. Often their cortisol levels are too high relative to their testosterone levels from overtraining syndrome. Adaptogen herbs can be helpful. People recovering from infectious diseases, with influenzas and other types of infections, where they're making a comeback but it's very slow, adaptogen herbs can sometimes move things along faster. And people where their immune system is already weak, and people that have just had chemotherapy or radiation or infection, or they're diabetics and their immune system is weak, adaptogen herbs can often be helpful in bringing the immune system back. People who have mental health issues as a source of prevention or the adjunctive management of depression, anxiety, stress, burnout, where stress is a factor, adaptogen herbs can be helpful. In men with declining libido and sexual performance issues, sometimes adaptogen herbs help to bring them back. Their vitality and virility comes back. Women that have menopausal symptoms where standard treatment and even natural treatments haven't been effective up to this point, sometimes stress is a factor, and getting that cortisol level down and having the other great impacts that adaptogen herbs have on body systems can often improve even the management of menopausal symptoms. In individuals that have signs and symptoms of an underactive thyroid, where their thyroid tests are normal but their metabolism is slowing down, should be aware that high cortisol levels can block the effects of thyroid hormone in cells and actually slow your metabolism down even though your thyroid blood tests look normal. Sometimes adaptogen herbs help individuals get their metabolism back and they can lose weight or get to their ideal weight more effectively. And people with sort of sleep disturbances where stress is a factor, sometimes adaptogen herbs are the secret ingredient. And also individuals where there's decreased concentration and learning ability in a stressful situation. Think about students who have to write an exam. Taking adaptogen herbs leading up to the exam can actually help to have a more calming effect on the brain and open up channels so that memory and concentration actually can be heightened and improved. And if you're anticipating a stressful event on the horizon, taking adaptogen herbs in advance can sometimes help mitigate the effects of stress on your brain. Same on physical function. If you're anticipating a heavy physical workload, taking adaptogen herbs 2 or 3 weeks prior can sometimes decrease the toll that the physical work takes on your body and give you more endurance and stamina. Also, in patients with early stage memory loss, along with other nutrients that support memory, adaptogen herbs can be helpful. People that have had sort of hair loss due to stress, adaptogen herbs, I have seen it actually help to bring some hair growth back. I've seen this in my own experience with patients. So even as an adjunct to a weight management program where stress is a factor, as I alluded to earlier, and it may be a thing to add to the sort of adjunctive management of certain neurodegenerative conditions like Parkinson's disease and early stage Alzheimer's disease, and certainly in people that have autoimmune conditions that affect the joints. It might be a consideration also to help keep the inflammatory component from cortisol lower. So if any of this sounds like it applies to you, then my personal preference is a combination containing a combination of Ashwagandha, Schisandra, and Rhodiola. So I've included the scientific references for these stress-fighting adaptogens with reference to the things that we spoke about today in the text below. So thanks for watching, and I'll see you next time.